We're a couple minutes after the hour here, so I think we'll go ahead and get started. Um, Thanks everybody for coming. This is a statewide lab advisory meeting, May 13th, 2024. I don't have a whole lot for you today. At the top here, we've asked Jeff Hammock to talk about some of the tick testing or the tick situation that's going on here in Nebraska. I think I saw Jeff, you're on already.
Yep, I'm here.
Cool. Did you have any slides to share or no?
Yeah, I actually do have some slides. Can I go ahead and share my screen?
Yeah, let me find you and make that happen. Okay, you should be able to share your screen now, Jeff.
Okay, it looks like. All right. All right, can you see this? See the slides?
Yep, got it.
All right, perfect. Well, I guess I'll go ahead and get started then. So, yeah, I guess good afternoon or good morning, depending on where you're at in the States. Just thought I'd give you talk a little bit about the medically important ticks of Nebraska here. Before I really jump into that, though, just a little quick tick biology. So ticks are arachnids. So they're related to spiders, mice, scorpions, and other eight-legged creatures. They're what's called obligate hematophages. So they need blood to survive and move from one life stage to the next. And there's actually two groups of ticks. There's what we call the hard ticks, the Ixodidae, and then there's the soft ticks, the Argacidae. And I got some pictures down there. I think what we think of ticks, most of us, we're going to think of the hard ticks, and that's what we're going to cover in this talk today. That's what covers most of our medically important ticks here in the U.S. as well as Nebraska. However, the soft ticks here, they look to me a little bit of kind of otherworldly. They don't look like the typical tick when you think of it. These can transmit diseases, but are typically associated with more rustic type settings, so rustic cabins, and that's usually because they hang out in rodent burrows. And so if there's rodent burrows nearby these rustic cabins, these ticks can get inside via rodents coming scurrying through and living inside those dwellings, and then they kind of act like bed bugs. When you fall asleep at night, they come out, they feed, and then they go back into the walls. And then digest their blood meal there. And they've been linked to some things like relapsing fevers, but for all intents and purposes, we're going to concentrate on these hard ticks here in Nebraska. So the ticks that I'll be covering today are what's considered three host ticks, meaning that it takes three different hosts for them to complete their life cycle. And this can take 1 to 2 years, just depending on whether or not the tick can find a suitable host for those life stages. Our first stage, this is where, we have the female, she lays eggs initially. After a certain amount of time, those eggs hatch out. These little 6-legged larvae emerge. They then get onto a small mammal, perhaps even a bird. And then they will feed until they are full, and then they will fall off to the ground. They'll crawl under some leaf litter, molt, and then after a certain amount of time has passed, they will emerge as these 8-legged nymphs. These 8-legged nymphs, again, are typically going to get on some small to maybe to medium-sized mammals. They will get on there, they will feed to repletion, they'll drop off on the ground, and they'll go under some leaf litter again, undergo their last molting stage, and then eventually they will emerge as adults. And it's in this adult stage typically where we see these ticks getting on larger mammals, maybe livestock, pets, people. And typically what happens here is the male really isn't going to do much feeding for most species. What he's going to do is he's going to actually mate with the female. After that's completed, he typically falls off and dies. The female will then take a full blood meal, and then after she has her full blood meal, she'll fall off, wander away into the leaf litter, lay her eggs, and then she dies, and then again our life cycle starts over. So that's a quick little on the tick biology 101 there. We'll start talking about the main ticks here. So our first one is the American dog tick. It's our most prevalent tick in most areas of the state. I'm sure a lot of you have seen this tick or have come across this tick, be it you finding it on yourself, your pets, maybe your children. It's pretty much when I think of a tick in Nebraska, this is what I think of. You can see the three mobile life stages here: the larval, the nymphs, and the adults. Typically, it's going to be the adult males and females that are responsible for any disease transmission, particularly adult females. We don't really see larvae or nymphs getting on people. They may get on pets, but primarily for people, it's going to be these adults, and particularly adult females, the ones responsible for most of the pathogen transmission to individuals. This tick is primarily a grassland tick, so you find them kind of on these grassy trails and these grassy areas. You can sometimes find them along wooded edges that are grassy too, but especially, like I said, on these grassy, trails and stuff, these can be, pretty densely populated along those edges. It's a vector for things like tularemia, as well as Rocky Mountain spotted fever, and even potentially other spotted fever rickettsia species that may have similar symptoms to Rocky Mountain spotted fever, but usually at a less severe case or a less severe presentation, but may present some similar symptoms. Our next one, Lone Star tick. That's our second most prevalent tick in Nebraska. And in some areas, it's actually going to be our most prevalent tick, particularly in parts of eastern and southeastern Nebraska. We are seeing this tick expand further west and north. And then if we look at those three mobile life stages again, we have the larval, the nymphal stage, and the adults. All three life stages here are aggressive and will get on and feed on people, pets, animals. This tick is what I like to call an active hunting tick. It will actually go toward its host instead of waiting for more of a wait and ambush approach like our other species. So, you can find all three life stages actually getting on and feeding you. The tick typically found in more kind of like grassy areas that are more with some wooded vegetation, maybe some wooded understory along like these, little wooded areas here. A little bit different than dog ticks, but you can often find these kind of in the same general areas. Lone Star ticks are vectors for things like ehrlichiosis, tularemia, potentially some other spotted fever group rickettsia, Heartland and Bourbon viruses. And then I also put on here alpha-gal, but I asterisk it because it's not a pathogen per se. It's actually an allergy. So the red meat allergy is what alpha-gal allergy is. It's been associated with repeated bites from this tick. So I wanted to put it up there because it is something that is getting a lot of attention, and we're starting to see, that it's probably more prevalent than what we realize. So I wanted to put that on there because I think it's also important because, again, all three life stages of these mobile life stages are aggressive towards people and will get readily onto people and bite. Next are kind of our what I want to say, kind of one of our newer ticks that we've seen invade Nebraska is the black-legged or deer tick. It's still relatively rare, but we are seeing it expand into areas of the state. If we look at our three mobile life stages, we see we have our larval, nymphs, and adults here. It's primarily going to be the nymphs and the adult female that transmit disease to people, in particular, nymphs especially. And that's because if I had like an actual live shot of this tick along with our other tick species, this species of tick is much smaller and harder to find than our other tick species. And with that nymphal stage being even smaller yet, that just makes that life stage really hard to find, even if you're doing really good tick checks after coming in from an area that might be tick habitat. It's still really difficult to find these ticks attached. This tick is a woodland tick, so I have some examples of some areas where we have found this tick, some of the sites, and you can see heavily wooded areas, not really that grassland type area we think of when we see some other of our other tick species, but really this heavily wooded area. Maybe along, you'll find some, if there's some grass running along a heavily wooded area like these forested areas, maybe you can find them there too. But, really they're going to be found out in these forested areas off these trails. This tick is a vector for a number of pathogens, including Lyme disease, anaplasmosis or ehrlichiosis, hard tick relapsing fever, and Powassan virus. And then our final tick here is what I want to say the newest comer to the state, and that's the Gulf Coast tick. As the name implies, it's found primarily along the Gulf Coast tick historically in the southeast, but over the years we've seen it kind of move northward, and we're actually starting to detect it in spots in Nebraska, so we are seeing it to expand into the states. If we look over here at our different life stages, really the larval and nymphal stages don't tend to really get on people. We don't really see that. It's primarily going to be the adult male and female. And again, it's going to be really the adult female that's responsible for most of the disease transmission. I like to think of this tick, it's kind of like if our Lone Star tick that we saw and our dog tick had children, this is what they would grow up to be. They have these long mouth parts like the Lone Star ticks, but they kind of have that body coloration, just like our dog ticks. So we've had some pictures that we've seen that people think these are dog ticks initially, but when we look at them, it's like, no, these are actually Gulf Coast ticks just because of those long mouth parts. Like dog ticks, it's found primarily in more grassy areas. Not necessarily along wooded edges or anything, but really in these open kind of grass areas is where we typically find these Gulf Coast ticks. And it is a vector for tidewater spotted fever, which is caused by the Rickettsia parkeri bacteria. Um, it causes an illness very similar to Rocky Mountain spotted fever, but again, it is very much less of a severe disease. One of the characteristics of tidewater spotted fever is an eschar at the tick bite. That is typically found in most cases of this tidewater spotted fever. Now, that's kind of, our four main ticks. So, what we're doing with our surveillance is we've gotten some funding from the CDC the last couple of years to actually do tick surveillance across the state just to get a better idea of, what ticks are where. I can, certainly tell you what I think might be in certain areas, but we don't really have that data to say, yeah, we definitely have found this here, this other species here. These are the pathogens they're carrying. So really with this tick surveillance, what we want to do is improve that information that's available, to the public as well as to providers, you as laboratorians, that may be talking with your providers. And we have four primary goals. We want to classify the county status for tick vectors. So is it reported there? Is it established? And there's some CDC definitions that we have to follow that determines whether that's reported versus established. But basically, we want to kind of fill in these white areas that you see on this example of a map here. Is we want to fill in those dots, to say, okay, is this tick found there? Have we actually looked there? Is it reported? Is it established? So we want to do that initially. We also want to identify the presence and prevalence of human pathogens in those ticks. So again, something very similar. Again, fill in the map. Have we detected that pathogen in that area? Have we not? Have we looked? And then once we really accomplish those two things, the next step we want to do is start estimating the density of host-seeking infected ticks. So this would be kind of like a risk index. So if you have a higher density of infected ticks, probably going to have a higher risk of coming across a tick that may be infected with a pathogen. And then our last thing we want to accomplish is, document the host-seeking phenology. Basically, we want to look at that life cycle. When are we seeing ticks most active? And then that can kind of help us guide in terms of maybe when to start looking to start testing, for tick-borne pathogens, as well as improving public health messaging of when to be on the lookout and really start paying attention to ticks out in the environment. And here, the next couple slides, I just wanted to show you some of the data that we've collected from our tick surveillance activities from the last several years. So here we got our tick species counts by life stage from 2021 to 2023. And you can see we've collected almost 12,000 ticks over that time frame. The one we've collected the most of is the Lone Star tick. However, I want to point out that most of that came because we collected almost 2,500 larvae from a couple of sites. What happened there is, we were out doing some sampling in late summer, early fall when the larval Lone Star ticks are active. And we came across some tick bombs. And so we didn't just find a couple of larval ticks. When you find Lone Star larval ticks, you usually find several hundred to several thousand. So that really kind of artificially inflates that total. But if we had taken away those larvae, we'd see American dog ticks are most prevalent, followed by the Lone Star tick. And then you can see with our Gulf Coast and black-legged ticks here that they make up a smaller percentage of the ticks that we've collected. Now, what we want to do with that, as I said, is we want to be able to, show this data, present this data to individuals, the public, the providers, and other stakeholders. And so we've created an interactive tick surveillance map on our website. And I do have that link that's in the slides here, and I'll share those with Ben and that here, and you can send out to folks. But we wanted people to go out and visualize this data. So when you go to our site, you can go on these maps, you can scroll over it, you can click on them, and there'll be pop-up windows that pop up. You can kind of see here, we've color-coded them. So what's an established county versus reported for each of the different species. So that's available on there. And then in addition to just looking at the tick distribution, we've also done some limited pathogen testing in our ticks. So if we look at our non-black-legged ticks, so the dog tick and Lone Star tick, you can see we are picking up pathogens, certainly. With the dog tick, I think something that's been interesting is we've had a couple positive for Ehrlichia ewingi, which we tend to think is more Lone Star tick. A little over 1% have been positive for Francisella tularensis, and we've actually picked up both type A and type B Francisella tularensis in those ticks. We've even had one detection of Rickettsia rickettsii, so this is the causative agent of Rocky Mountain spotted fever. We know it's typically really rare in ticks itself, but we often see a lot more cases reported than what is, what are probably not true Rocky Mountain spotted fever cases. And that's likely due to this other spotted fever group Rickettsia. So this is the non-Rickettsia rickettsii bacterial group. And you can see we have about 4% of our dog ticks testing positive for one species or another of this other spotted fever group Rickettsia. Lone Star ticks, again, no surprise here. We're seeing, a lot more positives for Ehrlichia chaffeensis than dog ticks. I think the thing that I find interesting is that we actually have a higher percent positive for Ehrlichia ewingi than Ehrlichia chaffeensis, which if we look at some of our surveillance data, most of our cases are classified as Ehrlichia chaffeensis. Most of that is due to the serology tests not really being able to differentiate the two different species. It's more of a general serology test to pick up Ehrlichia. And so that probably plays a big factor in us, classifying most of our cases Ehrlichia chaffeensis. The new updated case definition will kind of help us out here starting this year to kind of hopefully clear that up a little bit more in terms of using that serology test. The other thing we can see here, about 25% of our Lone Stars are testing positive for spotted fever group Rickettsia, and then 1% for this Borrelia Lone Stari. Looking at our black-legged tick pathogen testing, you can see 28% are testing positive for Borrelia burgdorferi, so that's the causative agent of Lyme disease, so a pretty good percent positivity there. And we actually even detected Borrelia miyamotoi, which causes relapsing fever. We've had a couple positives there. The one thing I do want to point out with these black-legged ticks, all these positives for Borrelia burgdorferi and Borrelia miyamotoi have all actually come from one county, and that's Thurston County up in northeast Nebraska. And that's the county where we had our first locally transmitted Lyme disease cases. If we just look at the ticks tested there, about 50% of the ticks are positive for Borrelia burgdorferi in that area. So, and we've picked up at least one positive tick for Borrelia burgdorferi from each of our sites we've sampled there historically. So that county really seems to be a hot spot for Lyme disease in these ticks. Whereas if we compare that to, say, Douglas County, where we've tested a similar number of ticks, we haven't detected any pathogens in those ticks that we've tested from Douglas County. And that could be due to a number of things. Could be the different types of hosts that are in each of around those sites. Maybe up in Thurston County, there's more of the suitable reservoir host for Borrelia burgdorferi in that area compared to what's in Douglas County. Maybe it's, there's actually two different strains of the black-legged tick. There's more of a northern strain and a southern strain. Could that be something that's playing a role? We just don't know, but it's something we're hoping to hopefully maybe kind of figure out here as we go into the future and do some work with some other colleagues with looking at this tick. And again, we want to share this data and make it available with this pathogen testing. So here are just some examples. This isn't all the pathogens we test for, but this is just some examples from each of those ticks I wanted to show in terms of what we want to be able to show folks, the general public, providers and whatnot. And again, you can actually go to, when you click on these maps, you can go click on the counties and it'll tell you how many ticks have been tested and how many positives we've detected. And then that's our tick surveillance map site. Like I said, I will share these slides with Ben and he can send those out so everyone can have that link. And then if anyone has questions, I'm more than willing to answer any questions. So I'm going to go ahead and stop sharing my screen there and hand it back over to you, Ben.
Okay, thanks a lot, Jeff. That was very interesting. Are there any questions for Jeff? Jeff, I think I have a question. I've heard a few times this year that the ticks are really bad. Are there more ticks out there than the last couple of years?
I like to say if I had $1 for every time, I heard somebody say it's the worst tick year ever, I'd be a rich person right now. But this year, I think because we've had a warmer winter, we haven't completed all of our surveys yet. We just started, but because of that warmer winter that we had, I imagine that we will have a bigger tick crop, so to speak, than when we've had in previous years. Just because, without that cold weather to really kind of knock down some of that population, especially early on here in tick season, we're probably seeing more ticks than we would normally see this time of year. I've looked at some of our syndromic data for tick bite visits, and we're just a little behind where we were actually last year at this time. But I haven't looked for the end of last week yet, but it looked like it was starting to pick up steam pretty quick. So I imagine we'll see a bigger increase and probably more visits for tick bites this year, just due to that fact that we had such a warm winter that we probably are seeing more tick activity, especially early on here.
Okay. So it does hold a little bit of water. Thank you. Any more questions for Jeff?
Hey Jeff, two questions. Number one, the established versus reported, what's the difference, and how we kind of, what's the definition basically? And then the second thing that I was thinking about is if we know that there is a population or a county with the concentrated Lyme organisms being identified in the ticks, the Borrelia burgdorferi. Is there a concern that it may eventually spread further, or do we need to do something? Can there be something done? Those are my just two questions.
Okay, yeah, I'll take the first one. So the difference between those established and reported. So with the reported, what has to happen is within a given year, so with a 12-month times frame, we have to either pick up 6 individual ticks of that species or detect 2 different life stages of that tick at a site. So that's what would make the county established. If it's reported, then we haven't met those other thresholds. We haven't detected 6 individual ticks, nor have we collected 2 different life stages. So that would be something like, okay, we found 1 or 2 of species A, but nothing else for that 12-month period. So that's the difference between what's reported versus established. And again, that's something that CDC came up with. We've had some areas where we've collected the same tick 2 to 3 years in a row, but it's been 1 or 2 ticks each time. And so it was one of the questions I want to ask CDC is like, if we detect them for multiple years in a row, can we, is there a way to maybe update that definition? Because I certainly think that it's probably established at that point. It's just at low numbers. Regarding that second question about, having just one county right now that's positive. Yeah, certainly some of those other areas, it potentially, we could have pathogens there. It's just that we have not tested enough. Maybe the infection rate is really low in that area. And maybe that's not why we're not picking it up, just because also maybe that, the tick burden itself, so the tick density is also low. So it doesn't necessarily mean that we haven't found it there, or it's not there. It's just that we haven't maybe tested enough. But, certainly we are seeing this tick in a couple more areas. We're just picking up in a few more counties, again, at pretty low numbers. And in some of those areas, when we collect 1 or 2 ticks, if it's a new county detection, we're not testing that tick just because we need to have a what's called a voucher specimen to save for historical purposes, in case there's any questions whether that is a tick, a black-legged tick from that county. But, I would say what's, my hypothesis is going to be is that we will probably see more areas with, where we find this tick, that we will find pathogens associated with it. It's just more of a matter of finding enough ticks to test. Like I said, my guess is that we just haven't tested enough in some of those other areas because either the infection is so much lower, so we're gonna have to test more ticks to pick that up, and then also that tick density just being really, really low. And then what I foresee probably happening is where we're seeing a lot of these black-legged ticks is they seem to be following kind of along, like there's 2 kind of when I want to say focal points, we have Northeast Nebraska, and then we have kind of in the Omaha metro area. And so another thing that could potentially be playing into that is what strain of ticks are these? Are these more of that northern strain, which tend to quest higher in areas like northeast part of the U.S. and the upper Midwest? If that's the case, they get more on people, especially nymphs. But if it's more like, say, around the Douglas County area, the metro area where we're seeing our other focal point, those are more the southern strain. Those ticks tend to behave a little bit differently and quest lower in the vegetation and don't tend to get on people, which is why we see lower rates of Lyme disease in the southern states. They certainly have black-legged ticks, but they just quest lower. So that could be potentially something too. The other potential is too that the reservoir species are going to be rodents, white-footed mice, deer mice. Maybe we just don't have those in these areas, and that's something what we don't do surveillance on. We don't have funding or capacity to collect mammals currently, but it's something we've been talking with other partners about, maybe potentially looking into to maybe get some information and data on that to see, maybe give us a little more info in terms of and try to make more sense of what may or may not be going on across the state for black-legged ticks.
Thank you, Jeff.
Any other questions for Jeff before we move on? Okay, thanks a lot, Jeff. Okay, so next up, I'm just going to mention here that a lot of this tick testing is actually going to be moving to the NPHL, was being done at a different lab. So that's, aiding the DHHS and that surveillance that Jeff was just talking about. Heartland and Bourbon virus, and Jeff, feel free to jump in and correct me if I get any of this wrong, but the Heartland and Bourbon viruses will be testing here, just kind of in the southeast portion of the state.
Yeah, that's correct. We're going to concentrate on areas kind of closer to where the initial Heartland virus detection occurred in Missouri, a number of years ago. And that was, the initial site was just about roughly 40, 50 miles from the Nebraska border there in southeast Nebraska. So we're going to concentrate our efforts there initially. And then if we start picking it up, we'll see if we can expand that surveillance out in years to come.
Okay. And then we'll be picking up some bacterial testing for, your Rickettsia species, Ehrlichia francisellus. And these are all big pooled samples, correct? We're just trying to detect the pathogen in certain areas.
Yeah, we'll be doing pool testing there, and it's very similar to what we do with our mosquitoes. We pool test, and that's we'd love to test individual ticks if we could, but it's just more of a kind of a funding issue. We just don't have enough funding to test the thousands of ticks we we'll need to test, so they'll be pooled.
Okay, does that information stays like inside a single county if you find disease, or are we looking at bigger areas here?
So our goal is hopefully within 5 years to be able to sample at least one site in each of the 93 counties. A couple might have a few more sites sampled just because we're looking at publicly accessible areas, especially that have a lot of people maybe that visit and go into those areas, such as state parks, state rec areas, etc.
Okay. That's really all I have for the tick testing that's going to be going on at NPHL. Said it's similar to the mosquito testing. Thanks again, Jeff, for answering those questions. Last thing for my laboratory topics, I wanted to bring up the 2024 Nebraska Antimicrobial Stewardship Summit is approaching quickly, May 31st. That I included a link for registration in the agenda. Actually, I think I have it here. Yeah, I'll put it in the chat too. Yeah, that's right around the corner. So if you're interested in attending that, talking about the impact of antibiotic intervention and antimicrobial stewardship. Dr. Ashraf, anything to add?
Yeah, so I think that's a great meeting, because this allows us to do our annual report out for the healthcare associated infections and antimicrobial resistance program overall, where we are focusing on what situations we are dealing with, and then we'll have various national and local speakers who will be discussing various strategies on promoting better antibiotic use and decreasing resistance patterns, decolonization strategies, and things like that. So I do believe that. No, I think I will have to look it up, but I think we also have in the past at least lab credits, and let me just confirm. I think we may even have lab credits on this one, on this summit also, but something I will need to double check.
Yeah, I can send out that updated
Yeah.
information. Probably when I share Jeff's presentation. So that's all I have for laboratory topics this month. Any questions or comments before we move on? Okay, we'll go into the DHHA section updates.
Yeah, I just kind of the credits I was able to pull it up. So it says ACCME credit, ACPE credit, and ANCC credits are available. So just people who are looking for credits, those are the credits that are available. Sorry.
Okay, yeah, no, good. Thank you. Okay, moving on to the section updates. First, we're going to start with the hospital acquired infection antimicrobial resistance team. I don't think Ishrad is here today.
Yeah, I don't think we have any major updates. We are still actively looking for Candida auris cases. We have identified, many of the folks who were in contact or overlapped in patient care with the 5 other cases that we have talked about previously in our HAN. So anyone who may have overlapped in care with those, we have a list of those individuals, and anytime they are admitted in a facility or a nursing home or a hospital, we do reach out to the facility and ask them to go ahead and make sure that these folks have not been colonized with C. auris. There is not a concern of community transmission at this moment, but if they are in healthcare, then we do reach out and ask for doing a colonization screen on those individuals. So far, we have done out of all the exposed patients that we have defined, we have done, I think, over a third of those patients tested already, but we have not found any additional cases even after testing over a third of those cases. So that's a good thing, but we should still be on the lookout as a lab, on finding C. auris cases. And if you are seeing something that that you are not able to identify, just reach out to the NPHL, and they will be able to do that. Or if you are worried about misidentification, you can also reach out to NPHL. And if you are not able to do especially further species identification on sterile samples that are growing Candida, then you can also reach out to NPHL. So I think we will be able to we will be happy to assist in those situations. I think that's basically the update.
Thank you.
Ben, you can add if you want to add anything on that. Yeah.
I was just going to say you're correct. NPHL, we're a resource to help you. Any questions, feel free to reach out to me or call the front desk. Somebody don't usually get a hold of me, or if you're looking for more information, I can email you flyers that have gone out recently or just discuss it with you. Thank you. Is Samir on for COVID-19?
Yeah, I'm on. So our COVID cases that's been reported to us have been decreasing, averaging about 11 cases per day. And in the past 7 days, About 77 cases were reported to us, and hospitalization numbers are also going down. And as of May 7, there were 17 active hospitalizations. So that's all I have for COVID.
Okay, thanks, Samir. Next up, RSV and flu. Derek, Julian, I have some slides here for Derek, and he was going to give us a little update on the avian flu. Let me get my other screen up here.
Perfect. Thanks, Ben.
Yeah. Okay, can you see that? Is that up there?
Yep, looks good.
Okay.
So yeah, I'll go ahead. Good morning / afternoon to everyone here. So I'm going to start with just a quick update on our influenza and RSV surveillance to show you where trends and activity levels are currently. So this first slide here hopefully looks familiar. It's coming from our weekly respiratory report and shared it a couple times on this call. It's showing the weekly number of influenza A and B positives by week overlaid with overall influenza positivity. And as you can see there towards the right side of the screen, for week ending May 4th, activity has really come down. Our positivity is down to about 5.5%. And the last time we were around that level was early to mid-December. So influenza activity is definitely getting closer and closer to what we typically see during non-season or summer weeks. And that has also been the case reported nationally and across other states. So we can go to the next slide. There's a couple more data figures showcasing our lab data. So this is looking at our A and B positivity by the past few respiratory seasons. So in red is the current season. The top half is showing influenza A positivity with the bottom influenza B. And as I mentioned before, we're getting closer and closer to what we typically see during non-season weeks, and seeing slightly more influenza A than B here over the past several weeks. Next slide, please. I think I have two more flu ones. So I just wanted to give a breakdown on what subtypes we're detecting across the state. So this data is showing the influenza A and A subtypes and B lineages. So for the most part this season, we've been seeing influenza A H1N1. That's indicated in the far left column in dark blue. And in the middle there is showing the influenza A H3N2s. As the past month or two, we've seen slightly more AH3N2s compared to the early part of the season, but still overall mostly AH1N1. And then of the flu Bs that have had a lineage determined, they've all been flu B Victoria. And that has also been the case nationally, as there hasn't been any flu B Yamagatas detected globally for that fact in the past couple of years, or several years for that matter. Next slide, please. And this is just taking that same data a step further. So what we're looking at here is the weekly proportion of influenza subtypes identified. That dark blue or the top bar is showing the influenza AH1N1s, and then that lighter blue is showing the AH3N2s. And just like I said previously, we see a little more of that light blue on the right side of the map. So those are the more recent weeks. But overwhelmingly still AH1N1s. Next slide, please. So I just have one data slide for RSV, just showing kind of what we've seen throughout the season. We've been pretty low with RSV activity for the past month or two, although we did see a little blip up in the positivity to about 2.5%, but nothing too noteworthy to report out on RSV. All right, next slide. I just have one more to give a brief high-level overview on highly avian influenza update. So just wanted to reemphasize, to date here in Nebraska, there hasn't been any HPAI positives in dairy farms. We can continue to work alongside the Nebraska Department of Agriculture, who is the lead agency, as well as other partners in the state to plan and prepare for a potential detection. And I just pulled some national numbers from the USDA website. And as of at least this morning, when I checked their website, they're still at 42 dairy farm detections across 9 states nationally. Overall, CDC is still considering the overall risk to humans to be low. And to date, there has still been just one confirmed influenza A H5N1 human case related to these dairy farm exposures. This was the case out of Texas that was reported a month or two ago, and this patient presented clinically with just conjunctivitis, and they did not report any respiratory symptoms. Now, the two main messages here I've bolded on this slide, and these 2 points are actually also included in NPHL's monthly newsletter, so hopefully you've already seen these. But really want to reiterate, firstly, if your lab performs molecular influenza testing and receives a test result of influenza A no subtype, please notify us at DHHS immediately and then get that specimen sent to the public health lab so we can do further subtyping on that specimen. And then secondly, if your lab ever gets a call from a clinician regarding the testing of a patient with suspected HPI infection, please direct them either to us here at the state or their local health department so we can get approval or discuss approving that specimen. So if approval is received, then we can go ahead and coordinate getting the appropriate specimen sent to NPHL. And then one little side note on this, if the patient would happen to report conjunctivitis, it is acceptable to send a conjunctival specimen along with other appropriate specimens such as MP swabs. And then that last bullet point is just a resource from CDC that touches on some laboratory specific guidance and recommendations regarding this HPAI situation, as well as some like healthcare professional and physician information. So I just wanted to point that out so you all have that. And I believe Ben will be sending these slides out as well. So if you have any questions on this or human or other respiratory viruses, please feel free to reach out to me now, and I'll go ahead and put my email in the chat just so people have that as well. So thank you.
Thanks, Derek. Any questions for Derek? Well, he's
what's the phone number that the physician is supposed to call? I have a doctor right now that wants to do H5N1 testing on a flu.
Yeah, hi Sandra. Are you with CHI by chance? Yeah, so I'm aware of that situation and working with the local health department to get that coordinated at the moment. So, but I can put my phone number in the chat if there's ever situations moving forward. You can go ahead and call me too.
Okay, so this is something I'm going to send to you guys.
Don't send at this moment. We're still discussing and doing a little risk assessment of this particular individual, but we'll be in touch.
Okay, sounds good. Thank you.
Yep, thanks.
okay. Thanks, Derek. We'll move on then to TB testing. Person on for any updates with TB?
Hello, I don't have any updates today. Thank you.
Okay, great. Thank you. At STD testing, STD program. Do we have anyone to speak to STD testing today? Okay. And then we'll finish out with lead testing.
Good day, everyone. Brian Coyle from DHHS. We don't have any report at this time. Thank you.
Sorry, I'm gonna, get the agenda back up there so we can all follow along. Okay, thanks, Brian. Just one note from the NPHL training side. If you received the last challenge set, we are aware that some of those organisms are struggling to grow in the lab. We are putting that back together this week. And so you'll be receiving a new set of organisms late this week, early next week. So you can expect that. And that's all I have from the NPHL training side.
Hi, Ben. This is Claire with the Enterix team. I think we accidentally.
Oh, sorry. Did I skip you?
No worries at all. We just have a small update. Sorry. We are in the midst of backyard poultry season. So as salmonella positives come through your lab, just remember to please forward those to NPHL so that we can get those whole genome sequenced and link them to any outbreaks. That is it for us. Thanks.
Thank you, Claire. I apologize again for skipping over you. And I guess, Jeff, I skipped over you as well. Did you have any other notes?
So we sent out the Lyme disease HON a couple weeks ago. The other tick-borne diseases, HON will be coming out, I think sometime this week. So that's about the only other update that I have.
Okay, thanks again. Okay, that would bring us to the end of our regularly scheduled program. Any last questions or notes or any introductions to be made aware of? Okay, well, that's all we have for the librarians. Next meeting is June 10th at 12 p.m. Central, 11 a.m. Mountain Time. Thanks, everybody, for joining us again this month. Librarians, you're free to go. Appreciate everyone who comes to these.